So May marks Skin Cancer Awareness Month. There are a lot of things to watch out for in order to protect yourself. Courtney's standing by this morning with the doctor to get us some advice.
Yes, we've got Dr. Corey Parsi with us this morning from the Kaiser Permanente in South Sac. Wonderful information when it comes to skincare, because it is May, as we talked about Skin Cancer Awareness Month. Everybody wants to get outside. It is time to get out and get into the sun. Oh, wait, I forgot my sunscreen and my protective gear, but we need to go the ABCDEs of skin cancer care, right?
Yes, I think it's very important, before we jump into all the protective measures, what can you look for on your skin to make sure they're not missing something that could be dangerous?
Right.
Melanoma, while it's not the most common form of skin cancer, could be deadly.
Okay.
So when we're talking about the ABCDEs of melanoma, the A stands for asymmetry.
So if the shape
the shape of the mole, if you cut it in half, one side should mirror the other side.
Okay.
If it's asymmetric, we don't like that.
We don't like that. Okay. And then B.
For borders, we want a mole to have nice regular borders. If it looks like it's growing an arm or a leg out to the side, not good.
So round moles, probably not an issue.
Exactly. If
Okay.
it's round and you can see clearly where it starts and stops, you're good.
Okay. What about C?
C is for color. So, moles tend to be tan or brown.
Yeah.
If a mole has multiple colors within it, so we're talking that has brown, red, white, that's also a concerning sign.
Interesting. And does that go for all skin colors and tones?
Correct.
Okay.
Yeah, we want to look for color irregularities and asymmetries as well.
Right.
And then the D is for diameter. So if you could think of a pencil head eraser, okay, that's about the size that we feel comfortable with. If a mole is growing a lot larger than that, then that's also a concerning sign.
Interesting. And then E is for the evolution of the mole.
Evolution or evolving. And I would say, honestly, that's probably the most important, because you may have a mole that's looked a little bit odd, but it's always been a little bit odd.
Okay.
If a mole all of a sudden changes, that's a sign that we want to take a closer look.
That some things are happening. Okay. Now, you mentioned South Sac Kaiser has this program where you can get, in certain circumstances, same-day advice on a mole or something that you see is just not quite right.
It's something that is hard to find in modern medicine, but Kaiser Permanente really leverages technology to provide the best care possible. And so at South Sac, for example, I was just telling you yesterday, patient came into their primary care physician, had a suspicious spot on the nose. 30 minutes later, they were in my office getting a biopsy.
Wow.
So it's a way to basically take out the middleman,
right,
and get the patient what they need when they need it.
Right away. Okay, so let's talk about preparing to go outside in this beautiful weather. It is gorgeous, right? You want to get out there and enjoy it. But some things that we probably take for granted. We see the sunscreens, we see the hats, but do we use them?
It's very important, obviously, to try as much as you can to minimize risk.
Yeah.
And we know that ultraviolet exposure with UV rays is the most modifiable risk factor we have. So as much as you can protect, the better. Obviously, there are sunscreens and sunscreen lotions, sprays. The big thing is, as much as you can, whether it's from a sunscreen or protective clothing.
Okay.
Seeking shade, avoiding peak sunlight hours. So 10 a.m. to 4 p.m. are when the rays tend to be the most harmful.
Okay. Can we talk about how much sunscreen you're supposed to use?
Yes.
So like head to toe, right? If all the things are exposed, how much sunscreen are we supposed to use?
So theoretically, most people probably don't apply enough.
Okay.
Okay, so we have this little tablespoon measuring cup. So you probably need 2 or 3 of these to cover most of your body. It is a lot. And most people probably are putting on a lower amount than that. So you're not necessarily getting the full SPF value that you're wanting.
What if you're using a spray? How do you know how much to gauge when you're applying?
Okay, with the sprays, my general recommendation is don't do this, because then you're breathing in all kinds of stuff.
Right.
I tell people actually spray it into your palm.
Okay.
And then rub it on.
Yeah.
And it's really good for the scalp, where a lot of people may be a little bit thinner. Obviously, in my case, I just need to get it everywhere. But I tell people spray it into your palm, then rub it on the affected areas.
All right. This is my own personal PSA that I feel like I need to do every year. And now that I have a dermatologist in studio, do Black people need to wear sunscreen?
I would say yes. It's,
Sorry, you were saying?
No problem. Obviously, if you have tan or brown skin, you do have some built-in protection. Not as likely to sunburn, but you still can.
Absolutely.
And we do know that skin cancer can still pop up in any skin type.
Just saying. He's the one with the degree. I just happen to be standing next to him. Just wanted to pass the message. We're going to link in all the details for Kaiser Permanente for the dermatology department to our website, gooddaysacramento.com, under show info and today's date. If you stay ready, you don't have to get ready.
Exactly.
Thank
Thanks,
you,
Court.
Dr. Parsey.
Thank you.